We are holding a hearing on our nation's child care crisis. Ranking Member Burr and I will each have an opening statement, and then we will introduce today's witnesses. After the witnesses give their testimony, senators will each have 5 minutes for a round of questions. And before we begin, as always, I want to walk through the COVID-19 safety protocols in place. We will follow the advice of the attending physician and the Sergeant-at-Arms in conducting this hearing. We are all very grateful to our clerks and everyone who's worked hard to get this set up and to help everyone stay healthy and safe. Committee members are seated at least 6 feet apart, and some senators are participating by video conference. And while we are unable to have the hearing fully open to the public or media for in-person attendance yet, live video is available on our committee website at help.senate.gov. And if you are in need of accommodations, including closed captioning, you can reach out to the committee or the Office of Congressional Accessibility Services. I'd also like to thank Senator Burr for working with me in a bipartisan way to hold this HELP Committee's first child care hearing in years. This is long overdue. I know this issue is important to Senator Burr and every member of this committee, given its impact on so many families and workers. I look forward to more conversations about what this committee and the Senate can do to address the child care needs of millions of families. We are here today for people like Patty Lou. She's a mother from South Seattle that I spoke with last week. Early last year, Patty got her dream job. Then the pandemic hit, her child care provider closed, and her employer laid her off because she had to work fewer hours in order to care for her kids. Unfortunately, her story is not unique, not even close. Deja Reed is here today as a witness to share her own story of child care challenges. Millions of parents have lost hours, wages, and jobs during this pandemic because they could not get quality, affordable, accessible childcare. Studies show that childcare was the primary reason people left the workforce during this pandemic. This problem has been worse for working moms. Nearly half were forced to take unpaid leave to care for their children, and 1 in 10 quit their jobs due to this pandemic, the majority of whom cited childcare as the reason. And the numbers are even worse for women who are paid low income, women who work part-time jobs, and women of color. And at the same time, this pandemic has highlighted how important childcare is to build an economy that works for working families. It has also devastated the childcare sector by jeopardizing childcare for 4.5 million children, closing more than 20,000 childcare centers and forcing 1/5 of childcare workers out of work. This loss has been deeply damaging to the families who rely on these providers, childcare workers, the vast majority of whom are women, and businesses who are losing employees who can't find or afford childcare. It's especially hard on communities of color, as half of childcare businesses are minority-owned, and nearly half of childcare workers are women of color. I've been speaking with childcare providers throughout this pandemic about the support that they need to keep their doors open. And it is clear that COVID-19 has made things harder. But make no mistake, childcare was in crisis before this pandemic. One mom in Washington State spoke about reaching out to 20 to 30 childcare providers over 5 years, switching providers 3 different times, and driving 45 minutes both ways to get childcare for her daughter so she could go to work. And for many families, even that is not an option. Over half of our country lives in a childcare desert or a community with an undersupply of licensed childcare options. And for families with low incomes, families of color, and rural families, childcare is even less available. In Washington State, there are over 50,000 children under age 5 across Benton, Columbia, Franklin, Grant, Kittitas, Walla Walla, and Yakima counties. But even before the pandemic, childcare was only available for less than half of those kids. And even if families have a childcare provider within reach, it's often far too expensive. In D.C. and 29 states, childcare costs more than in-state college tuition, including in Washington State, where the average yearly cost for childcare is nearly $15,000. For families with low incomes, childcare costs over 1/3 of their income. And while families are paying too much of their incomes for childcare, childcare workers are being paid far too little. These workers are doing the incredibly important job of caring for and educating children, so parents are able to go to work and provide for their families, but only making, on average, $11 an hour, and they rarely have any benefits. We talk about crumbling infrastructure when it comes to roads and bridges, but we've never really had childcare infrastructure in the first place in this country, which has cost our nation $57 billion in lost revenue, productivity, and wages each year. It costs parents who have to forego careers and job opportunities or struggle to put food on the table because they can't afford the childcare they need to find a job. It especially costs parents of children with disabilities and women of color, who are much more likely to be unable to look for a higher paying job because they can't find or afford childcare. And it costs our children, who miss out on high quality early education that can help them grow and thrive. With costs so high, we cannot afford inaction. This issue is personal to me. I know what it's like to have a sick child and have to talk with your husband or partner about who will miss work to watch the kids. I know what it's like to work at an early education program. Early childhood programs are part of what got me into politics in the first place, to save a co-op preschool program that helped families like mine. It's why I worked in a bipartisan way to secure the biggest ever increase in federal child care funding in 2018. It's why during COVID, I fought to secure over $50 billion in funding for childcare to make sure our childcare sector can survive the pandemic, keep hundreds of thousands of providers who serve millions of children from closure, and help almost 1 million families across the country afford quality childcare. And it's why I'm continuing to fight to pass my Child Care for Working Families Act, which will ensure childcare is affordable for working families. It will expand access to preschool programs for all 3- and 4-year-olds and improve the supply and quality of care for all children, and increase compensation and provide training for childcare workers. This legislation will jumpstart our economy by creating 770,000 new childcare jobs, helping 1.6 million parents, primarily mothers, go back to work, and lifting 1 million families out of poverty. Because the reality is, childcare is a critical part of our infrastructure. We have 21.5 million workers who have a child under the age of 6. They need the basics to be able to do their jobs. And the basic does mean bridges and roads, but they absolutely also mean childcare. Ask any mom, ask any parent, ask Deja Reed or Patty Lou, and they'll tell you a road won't do you much good if you can't find safe child care for your kid. If we are going to rebuild from this crisis stronger and fairer, if we're going to build an economy that truly works for working families, we can't do it without childcare for every working family. With that, I will recognize Ranking Member Burr for his opening remarks.